Okay, so today's session is on medical diagnostics, and we're also going to be discussing how diagnosis works, and we're going to be discussing why it happens and how treatment plans are created. So first of all, what are medical diagnostics? So diagnostics itself actually means the identification of an illness that someone might have. And in this case, in diagnostics and the diagnosis of a medical illness, there are three aspects which are very important. These are diagnosis, prognosis, and treatment plans. We're going to be talking about each of these briefly. First of all, the first step, which is diagnosis, is done by looking at pathophysiological changes. So these are clinical features which have appeared from a change in the normal anatomy of a person who's healthy and does not have diseases. Etiology is what causes the pathophysical changes to happen. So etiology is the study of causality, and some etiological factors and features are environment, epigenetics, and genetics. Okay. So first of all, we're going to talk about signs and symptoms in clinical features. Clinical features are basically features that a patient presents with inside when they come for their appointment and what they present with. So we're going to talk about physical features and symptoms. Physical features refers to refers to the idea of things that you can see, hear, smell, feel, etc. And there are obviously other features which you can't see. So there are four different investigational methods. There are observations. So what can you see? Redness, pus, discoloration, or even an abnormal bunch of cells or tissue with a strange color. Auscultation, which is what can you hear? Possibly using a stethoscope. Is there wheezing? In that same vein, can anyone think of what exactly, if you're using a stethoscope, you might hear? Perhaps on a certain organ, etc. Someone said you were wondering if the recording will be posted on our Insta. No, but the recording will be on YouTube, and it's on our YouTube channel, and you can just type in the medical debate on YouTube to see all our previous recordings. This one will be uploaded by the end of the day. Yeah, would you like us to post it on Insta as well? Just let us know. Could we have the link, please, to the YouTube channel? Yeah, I'll get that up. Just while I'm finding out the YouTube channel link, can anyone tell me, what could you hear if you were using a stethoscope? Let's say on the heart. Let's say if you put the stethoscope on a heart, normally you would hear beats, at a certain interval, because the heart's normally beating. What would you hear if there was some problem? Any kind of problem, what could you potentially hear? Any ideas? That's fine if you don't have an idea. It is a slight arrhythmia. Yes, someone said arrhythmia. That's a very, very good answer. Any other ideas? Okay, that's fine if arrhythmia is what we've come up with so far. That's completely fine. The other thing that people have heard sometimes is murmurs in the heart. So a slight murmur might indicate that you have an unhealthy heart of some sort. And obviously, you can't rule down immediately exactly what that person has, but you can tell that something's wrong, and then you can localize your investigation to the heart. The next thing that's very important is palpation. Palpation is when you touch the area, what happens? Do you feel a bump or maybe a roughness? It's quite common that certain areas might be a bit more firm than you think they should be, or they should be in the normal anatomy of a human who doesn't have a disease. Or if you touch an area, maybe it gets bruised very, very quickly. Maybe if you accidentally scratch it, it immediately goes red, if you understand what I mean. So it's very, very important to realize that touching and investigation, obviously with consent, is very, very important, because that can tell you quite a few things about how these symptoms occur and how they can respond to different stimuli, and that can obviously lead you to a disease that might be happening. The next thing is percussion. So when you tap that area, what happens? And another interesting one is smell. So obviously, as being a doctor, you will encounter so many different types of smells. And it's very important to sort of understand where each one comes from. And if you can understand the biology or the science behind each one, that's very, very useful. So is there a certain characteristic smell of anything? Diabetes, typhoid, and yellow fever all have certain smells. So some make the urine smell bad, some make the body, different areas make different smells happen. And it's very important that as you come across medical practice, or even if you read about this before going into medical practice, you understand what each disease does in terms of smell, because that's quite a telltale sign of certain disorders. Okay. One way that investigations happen is something called a PQRST assessment. So it stands for provoking features, quality, region, and radiation severity, and time. The P, which is provoking features, is what causes the pain to increase or improve, or what brings it on. Obviously, this is very straightforward. If someone's feeling very much a lot of pain, it's very important to see exactly why this is happening. If they're taking any medication, is this possibly a side effect? Is there anything we can do to stop this? And is there anything we can do to improve this? And sometimes, for example, if you guys know about rickets, it's said that if you put pressure on a joint, that can actually cause it to calm down. And, sometimes Q, what kind of pain is it? So Q is obviously the quality of the pain. Is it a stabbing pain? Is it a consistent pain? Is it, what kind of specific pain is it? Could I just remind everyone to please keep their microphones off, unless they want to say something, in which case, please go ahead. But maybe just message me beforehand. So, it'd be very helpful if you could just keep to that. R means region and radiation. So is it staying in one area? Is it spreading to other areas? Which area is this? Because obviously that's, again, a very obvious thing to think about. But if it's spreading to an area, it might mean that the disease itself is spreading. And if it's spreading, then that also gives us a clue about what it could possibly be. The S is severity, and you might have heard this as you were a child if you went to the hospital. To make this an easier thing for doctors to understand, they might say on a scale of 1 to 10, what level of pain are you feeling? If it's an increased pain, it might be a more severe side effect of the disease. If it's less pain, then it can tell you maybe it's not so difficult, and maybe the pain is, the pain is possibly because of something else. And when did the pain begin? Obviously leads to the T, or the time of it. And is the pain getting better or worse? Okay, does anyone have any questions? If you guys have any questions, please feel free to just keep putting them in the chat, and I will answer them as soon as I can, as soon as I've seen them. Regarding the YouTube channel, I am just, you can find our YouTube channel link on our Instagram profile. Just go onto Instagram and type in The Medical Debate, and it's in our bio, but I will get the link and send it here. Okay, next slide. Okay, so we're going to be talking about taking a history, and I'm sure you guys have heard of what a history is, or maybe seen someone take one in a virtual work experience, or even physical work experience, if you guys have any of you have done that. And there are actually different kinds of history that are very important. So can anyone think of any, it's a very obvious question, but can anyone think of any history that a doctor might need to know about a certain disease or from a certain patient to be able to understand what the patient has? Any ideas? Yep, so someone said family history, family. Okay, yeah, exactly. That's one really, really, really important type. You need to know if it is something that has a genetic factor to it. I've just pasted the YouTube channel link onto the chat. But if it's if it's something that lots of people have in their family, it might mean it's a genetic disease, which again narrows it down. And if you're thinking about personal statements, it might be important to realize that all of these are kind of like clues, and they come up to the sort of the answer of what a disease is. And it's very much like it's sort of it's kind of like being a detective where you take clues and trying to have to put these clues together to see the bigger picture and finally get an answer about what the disease is. Someone said current or past prescriptions. Yes, that's really, really important. So past history, but not family history, just of this person. If they've had this disease before, then, you know, maybe they took prescriptions for it, if they took a different medication for it, and we need to know what they've been taking, how much, and for how long. Someone said social factors like workspace or environment. Yes, very important, because they could be exposed to it from certain environmental factors. It's very important to know how this could have been. For example, food poisoning, it's very important to see if they've been abroad for the last couple of days, weeks, months, whenever, and also if they've come in contact with food that they don't normally eat from possibly a dodgy place in the recent history. So it's very important to know everything you can about this patient to try and help them out. Yeah, someone's already mentioned disease. Has anyone like this happened before? Anything like this happened before? And the patient's occupation. Yeah, so I think this comes under social history, but we're going to move on. And I think those are really good points. And these are the 4 types of history that are very important to be able to take. So, you know, we mentioned these already: history of symptoms, history of this disease, general medical observations, family history, all very important in knowing exactly what this patient has. Okay, so now we're going to talk about routine observations, and you might have heard doctors calling these OBS, but basically these are the things where you go into possibly a new clinic or a new branch of the hospital for the first time. You probably realize that they take height, weight, blood tests, and a couple other ideas, and that's what these are. So as I've written, temperature, height, weight, blood tests, and those are very basic observations to see how someone is doing in terms of growth. If they're a kid, or if they're an adult, then, you know, how their anatomy and physiology is being maintained throughout that time. So this can be used to, for example, in the blood test, this can be used to determine blood oxygen concentration levels, blood pressure, the pulse, how their weight is changing over time, obviously, you know, sudden decreasing, suddenly increasing, etc. These are pretty much basic things, as you can read on the slide, you know, investigations into the hematology, you know, if there's a low hemoglobin count, increasing hemoglobin count, etc., lead to x-rays, ultrasounds. Can anyone think of how any of these might be dangerous? Or why possibly you can't just take a blood test immediately or conduct some tests without knowing some other history of the patient? Possibly why is it dangerous to do some of the tests that we've got here? Someone said low blood level. Possibly, you know, if there's a low blood level, then I feel like that would be, if there's a low blood level, I'm not entirely sure on this. I feel like that would be pretty obvious, and so probably blood tests wouldn't happen anyway. But after trauma, oh right, okay. Someone said compromise health of individual when they don't know they're in a situation, like if a woman is present. Sorry, you're gonna have to explain that one. Or like if a pregnant woman is present. Or do you mean if if the woman doesn't know she's pregnant, for example? Hemophilia. Yeah, okay. So some people have yeah, so everyone has some sort of idea, but you know, if, for example, let's say they're allergic to a certain test, right? Some people are allergic to penicillin, they might be allergic to some test substances. Temperature, height, weight is obviously that they're tools which are people are not going to have a problem with, but with the blood test, people might be seriously needle phobic. Not only this, but you know, it's there's a huge amount of problems, but the obs are generally safe. The observations are generally safe, and obviously the hospitals aren't going to do anything that's unsafe to you if they know about what's happening. But I was thinking more, you know, if, for example, some people might not want to do x-rays, and as someone said, if someone's pregnant, that's probably not a good idea, or any radiation based testing is probably not a good idea for pregnant patients because of the baby. And you know, some people ask, why is it that the thing is with x-rays, it's not a ridiculously dangerous amount of radiation for someone, for a normal person, but obviously with the baby you don't want to complicate situations at all. So it's very important to realize that sometimes obs can't be taken, or specific observations cannot be made. Does anyone know what the difference is between a CT scan and an MRI scan? Any ideas? So these are two types of investigations that we mentioned in the previous slide. And if you don't know, it's fine. You can just throw out ideas there. Maybe, does anyone know what they stand for? That would be okay as well. Just any ideas.
MRI uses radio waves, whereas the CT scan uses X-rays.
Okay, yeah, so yes, that's
The
true.
basic difference in the diagnosis is this, that the magnetic resonance imaging tries to use the radio waves for visualizing the organ's images, whereas the CT scan uses the X-rays as its main source of radiation for capturing the images.
Yeah, okay, well done. So yes, CT does stand for computed tomography. I don't think anyone said that in the chat, but it stands for computed tomography. And as you said correctly, it does use X-rays. MRIs stand for magnetic resonance imaging, and that uses radio waves. Okay, what can we deduce from this? Which one could possibly not be used in certain cases based on what we said in the previous slide as well?
CT scan, because it employs the use of X-rays.
Right, okay, yeah. So, yeah, exactly. So for example, if you have a pregnant patient, you probably won't want to use a CT scan because it gives off X-rays. Okay, can anyone think of it? So someone said it shows different depths of the body. Can anyone explain that or elaborate on that? And to the person who has been contributing, thank you very much for your contributions, but
Thank you very much.
Yeah, does anyone else have any ideas? If I throw the word soft tissue out there, does anyone have any ideas? You know, which one is possibly better for soft tissue, which one is not? That's fine if you don't know. That's why we're here, to explain different things. Okay, so MRI is actually better at showing some diseases because some cancers that MRIs are better to show. So on CT scans, it can be very difficult to see certain cancers, such as prostate cancer or certain liver cancers. But on an MRI, they're a lot more easier to see. Same with metastases and quite a few other things. But then also they're used on different people, as we mentioned, because CT scans do use ionizing radiation, which can be more dangerous than radio waves, or is more dangerous, I should say, than radio waves. Okay, we're gonna move on. Okay, so this is how treatment plans work, essentially. And sorry, could I just remind everyone to please keep their microphones off, unless they want to add something. Thank you. So what exactly is a treatment plan and how does it work? A treatment plan is a detailed plan tailored to the individual patient and is a powerful tool for engaging the patient in their treatment. As you can see, this is from taken from a website, ICA Notes, which was when I was researching this to put the PowerPoint together, was very helpful, and it shows you all of the different things involved in a treatment plan. So please go and check it out. Treatment plans usually follow a simple format. So in this case, what kind of goals that does this patient need to reach in terms of their disease, objectives, which they can, achievable goals. I'm sure you guys have heard about. It's very important to set them and nothing too fanciful or perhaps unachievable. And how can we track this progress? So, possibly coming back after 6 weeks of treatment to check if it's going well. As it says on the top, it says assessment, planning, interventions, and evaluations. Evaluations is very, very important because we need to see if a certain treatment plan is doing well or not. and perhaps actually maybe a certain treatment plan might be causing harm rather than any good. So it's very important to recalibrate and try and find a different treatment plan. And the only way to do this successfully is to consistently monitor a patient's condition under a certain treatment plan. And it's very important, obviously, that, you know, we're trying to have interventions. And you might have heard about the debate, is prevention better than cure? It's very, very, you know, if someone has symptoms already, we're going to try and cure them. But obviously, we don't want them to have the same disease in the future. So you might have heard of people having some medication initially when they have symptoms to treat their symptoms, and then straight after they're put on preventative measures or preventative medications which stop, well, hopefully will stop them having the disease in the future. So there's a huge amount of things to consider in the treatment plan, and this is obviously where the knowledge of the pharmacology and medication comes in, which will be taught at medical schools, obviously. Prognosis, I'm sure you guys have heard of, is actually the likely progression of a disease. So, you know, you might have heard, after this many weeks of having this drug, it might improve, might decrease. How a disease progresses and how we can combat it at each stage, very important to know. And obviously this is where medical knowledge comes in very, very usefully. And it's very important that this prognosis plan and this treatment plan is individualized to the patient themselves, because although two patients might have the same disease, they will experience two different symptoms, two different variations of the same disease, and no two patients are completely identical. So it's very important that each patient is taken into consideration individually, which is something that you can actually mention in your, you know, which is something to consider when applying to medicine, that you want to provide individualized care rather than just treating a disease, you're treating the person. So we're going to do some practice. I've put together 3 slides where it's very, very common diseases, and I've put some symptoms. And I want to see if anyone can, you know, sort of use what we've learned today. It should be very simple, and just think of what disease might this be. Today was a much shorter session. Obviously, we had to do this earlier. And thank you everyone who's come today for bearing with us. But, you know, we're just going to try the next slides out, and just in the chat, put down what you think the diseases could be. First one, patient 1, a man presents with excessive urination, excessive thirst, unexpected weight loss, and increased time taken for their cuts to heal, any cuts or wounds. What potential disease or ailment could this person have? Just any ideas out of what you might know about certain symptoms. Hints, this is a very common, unfortunately, a very common disease. Someone's put diabetes. Any other ideas before I reveal the answer? Dehydration. Dehydration, is that a symptom or is that a disease? Or are you asking if they're presenting with that? Someone said low blood plasma or protein. Okay. So diabetes was correct. Now, can anyone tell me what type? What type of diabetes is this? Type 1 or type 2? Yeah, type 2, exactly. So someone said type 2, well done, it is type 2. So this is very, very simple, and you're not going to get anything simple like this in the medical field, or you might do, but this is, you know, a very, a cut and dry case. Is very easy to see exactly what it is. And the other thing is, I've also said that this is a very common disease. It's not going to be something rare and highly individualized that you guys might not have heard of. Okay, patient 2, sudden nosebleeds, bleeding gums, and very excessive time to taken to heal cuts or wounds. The picture on the right should give you some sort of a hint, and just think about this. It's not as common as diabetes, but I'm sure you guys have heard of it. Any ideas? If you can't think of what the disease is, could anyone tell me possibly?
Is it scurvy?
Sorry?
Is it scurvy?
Not what I was going for here, no. If you can't think of the disease, maybe tell me what the picture shows. Any ideas? Anyone? Someone said blood clot. Okay, good guess. I'll take one more guess and then I'll say hemorrhage. Okay, no, it's hemophilia. And someone did mention this in the chat previously for a different one. But it's hemophilia. And with hemophilia, I'm sure, I don't know if you guys know about this or not, but hemophilia leads to excessive bleeding. The blood doesn't clot properly or is easily. And so you bleed a lot when you've got a cut, and it's very, very dangerous for hemophiliacs to, or people with hemophilia to have cuts and wounds. But good guess. And as you can see, it's not always so easy to see. And as someone mentioned, scurvy, you know, you might think that two diseases have very similar symptoms. So it's very important to be able to try and differentiate it using medical knowledge. Okay, and the last one, patient 3, they have night sweats, fever, chills, and a persistent cough for over 3 weeks. Can anyone guess exactly what this might be? The picture on the right is a big, big hint.
Tuberculosis?
Yes, exactly. Yes, it's tuberculosis. Exactly. Well done. And again, you know, TB is not very common now, but that one, I guess, was easier. Just be honest, everyone. Did everyone, you know, get tuberculosis, or did anyone have any other ideas of what it could possibly be?
Although this kind of situation also occurs in some cases of bronchitis as well.
Okay.
Because even in bronchitis, there is persistent cough.
Okay.
There are night sweats. So there are few overlap between the symptoms, such symptoms.
Okay. Right. Yeah. Fair enough. Right. Okay. We're gonna. I think. Yeah. So this was a shorter presentation, as I mentioned today, but I just wanted to mention before we finish our YouTube channel. Someone did ask about it previously, but we have uploaded all of the previous sessions onto there, minus I think 2 because we lost the recordings. But there are 30 sessions up there, 30 full recordings of our sessions here on the YouTube channel where you can access all of them, and this one will be posted there by the end of today. So please feel free to go and check that out, and we are working to improve it, put more stuff on there. It's also got interviews that we've had with people from Imperial College, current Oxford University, and someone who holds a Cambridge University offer, and they're doing their second year now or first year. But it's, you know, if you guys want to catch up on some of the things that we've done before, please feel free to go and check it out. I've put the link in the Zoom chat. If you might have to scroll up. I might just send it again, actually. Give me 2 seconds. Okay, well, it'd take me a bit of time to find the link again, but you know, you can go onto our Instagram at The Medical Debate, and then you can find out the link as well. It's in our bio. Someone's just yeah, okay, right. I'll answer that question later. And last of all, just wanted to say thank you everyone for joining today. And if you have any questions, please feel free to talk to